The Sunflower Project, Cultivating Future Caregivers. Robin Barnes, Masonic Village at Burlington, New Jersey. Why are you here? What ignited your passion for aging services? Why do you do what you do? For me, it was the relationships I had with elders, especially Millie. My grandma Millie not only took care of me, she taught me a lot too, like how to play 500 rummy, how to make potato salad, and how to find humor whenever possible. She was my very best friend. She was 68 when she was diagnosed with Alzheimer's. I was 12. I began learning a lot about Alzheimer's, how it was going to progress, and what I could do to help my Millie. What I didn't realize at the time was that she was still teaching me, just in a different way. I developed a passion for caring for her and elders like her, and this passion just continued to grow after she was gone. Not everyone has a Millie, so how do we grow this passion for aging services and others? We plant it, cultivate it, and feed it. We grow it like a sunflower. My project is an intergenerational partnership between elders and children, bringing them together. Through shared experiences, virtual story time, guest teacher appearances, get to know me projects, socials, cooking demos. In this virtual age, the possibilities are endless. We can connect elders and students, planting that passion and empathy for elders at a young age. And we can nurture that excitement for meaningful interactions, watching a new generation of compassionate caregivers grow. All while giving our elders a sense of purpose and providing the students with an experience that will grow that passion to be lifelong champions for aging services. Why sunflowers? They stand confident, soaking in the sunshine of each day. When cloudy, they huddle together, sharing their warmth, supporting those around them. Let's work together to cultivate a future aging services workforce full of sunflowers.
Hi, my name is Karina Barragan. I am with Teleco Residential Management, and my project name is Creating a Supportive Community for Aging. Imagine your grandparents, parents, your friends, or loved one is living with limited income, struggling to access services, basic necessities such as healthcare, medication, social programs, and other basic necessities to stay in their home and in their community. Now, imagine these programs actually exist. All you need is someone like you or me who can guide them through the process and coordinate services, speak the language to access the services, and especially a language that looks different depending on the agency you're working with. The reality is programs and services currently exist in the community, but it requires agencies to share information that will support our residents to minimize duplication of services that can be costly. Creating a supportive community for aging requires knowledge of available resources, access to the necessary information and services, and being able to speak the language, and coordination of the services from a loved one or possibly a service coordinator. By doing so, we can reduce hospitalizations that can put burden on existing programs. We can minimize duplication of services that will allow more individuals to access services, and we can create a healthier community overall. COVID has reinforced disparate impact low-income seniors face daily. Resources and access and coordination to basic day-to-day resources can support to build supportive communities for aging in place with dignity and respect. By evaluating these programs serving the same individuals, learning the language to navigate the system, and working with loved ones or service coordinators, we can save monies by providing access to basic needs and improving the health of seniors to create a supportive community for all.
Hello, my name is Florin Barabosco. I work for Elizabeth Seeking Children in Yonkers, New York. And my ALP is utilizing data analytics to transform healthcare. Data has become key to a better organization, new developments, and innovation. The more data we gather, the better we can organize our work to deliver the best outcomes. Not long ago, the common practice was to store such data either on handwritten notes or typed reports. Not long ago, medical information was available on paper only. Technological advances throughout the healthcare industry helped us migrate all that paper information onto a computer system, and in the process, helped us generate more and more meaningful data. So what is data analytics? Data analytics is the process of inspecting, cleansing, transforming, and modeling data with the ultimate goal of discovering useful information. So what do we do with all the data that we gather daily, and how do we use it? A small case study. At Elizabeth Seton Children's Center, a multidisciplinary team composed of clinicians, quality, and IT meets monthly to analyze our residents' clinical data collected from medical devices with the unique goal of making safe, consistent, and personalized healthcare decisions. The graphic demonstrates how by reducing the resident minimum alarm value on a low heart rate from 65 to a safe 60, lowered the 7-day average number of bedside alarms from 72 to 2. In this particular case, analyzing data enabled clinicians to respond to bedside alarms that actually matter, eliminated alarm fatigue for caregivers, and created a more peaceful environment for the residents. Based on the data that we have today, these are a few of the healthcare industry areas that benefited from data analytics. In conclusion, data analytics is a journey in progress with a lot still to learn. The process has started and we are gradually moving through its learning steps. It is my personal belief that the future of healthcare will be data-driven. In tomorrow's world, data will be the cornerstone for delivering healthcare innovation and will allow healthcare systems to develop new ways of providing healthcare. Thank you, LeadingAge, for the opportunity to present. Thank you.
Hi, my name is Megan Bradford. I'm from Episcopal Retirement Services, and the title of my project is Beyond Our Walls, Creating a Dementia-Inclusive Community. When we think about dementia, there are a lot of words that come to mind, the large majority of them being negative. When I look at this image, I see words that jump out, such as isolation, loss, fear, depression. To address this issue as an industry, we've created big, beautiful life plan communities to serve people living with dementia. Over the last several years, Episcopal Retirement Services has been on a journey and dedicated to optimizing and adapting our residents' living environments and a suite of memory support, cognitive therapies, and services for those living with dementia. We have programs and ongoing support and education for their care partners. It's been a true culture change for our organization. But what about those living with dementia in the broader community? What are we doing as an industry to support people living with dementia outside of our walls? I believe that for these people to be successful, we must create dementia-inclusive communities. Inclusivity requires intention. It's more than just being friendly. We're able to create welcoming and safe places for those living outside of our life plan community. These people are able to engage, be supported, and continue to thrive. ERS recognizes that we cannot make the greater Cincinnati community dementia inclusive by ourselves. Without the support and buy-in of dedicated, like-minded organizations and pilot businesses, we would not be successful. With a steering team, we've identified both pain points and natural gathering places to join us in this initiative. You might notice that the community organizations and businesses on the screen are not all dementia care experts. ERS is committed to providing hands-on training and tools for each partner to be successful in their dementia inclusive commitment. All training materials and ongoing support are offered to partners free of charge. Each LeadingAge member can make a difference and make this same impact in their broader community. We are truly hopeful that we have the opportunity to support and partner with your organization by joining us in the journey of creating dementia inclusive communities. Thank you.
Hi, I am June Castle from Nucentra Health in Syracuse, and my action learning project is Homelessness, You Are Not Alone. There is some troubling evidence that homelessness is beginning to increase among elderly adults. According to national research, by 2050, the elderly homeless population is projected to be more than double, with 95,000 elderly persons expected to be living without stable housing. Understanding the pathways into homelessness for the elderly is important when determining the right policy response. Those older Americans who become homeless as senior citizens require preventive action. Federal housing programs are fundamental in reducing the economic hardships experienced by the elderly whose only income is Social Security. Alternatively, those older adults who are chronically homeless and remain homeless as they age have intensive housing and service needs that must be addressed to end their homelessness. This is where the path leads to the program Essentia Health St. Anthony's Senior Housing in Syracuse that is funded by Empire State Supportive Housing Initiative grant. Through this grant, this old church is being renovated into 52 affordable apartments, which half will be dedicated to provide supportive housing, resources, and services that will enable vulnerable, frail, elderly populations experiencing homelessness an opportunity to establish and maintain stable permanent housing. Being homeless is not only not having an affordable place to live, but also underlining health and wellness issues that need to be addressed. Through an Essentia Health program, these individuals will be offered on-site supportive services. Through specific person-centered supportive services, participants will benefit from improved health outcomes and knowledge that will foster long-term stability. Essentia Health will coordinate and provide on-site support services that include evaluation and assessment of needs, initial and ongoing for individual health and safety, case management delivered with a personal-centered approach under self-identified needs and preferences of the individual, preventive services, support, information, and options offered through community resources, supportive interdisciplinary team composed of various health, behavioral health and social services, providing ongoing and long-term follow-up and support, as well as other services that will help bridge the gap until the individual is able to be self-sufficient. This is where I ask for a call to action. I would ask everyone to ask their representative at both the national and state levels to increase the supply of subsidized affordable housing, create significant permanent supportive housing to finish the job of ending chronic homelessness, fund research to better understand the needs of the homeless elderly population, fund additional and ongoing supportive resources for this population. You never know who will benefit from these services. It could be someone that you know and love. Thank you.
My name is Rebecca Catalanato. I work at the Village at Gainesville, and this is my action learning project, Paying It Forward Through Mentorship. Chances are, if you're seeing this presentation, you're either a leader or somebody who's keenly interested in leadership. So I'd like to ask you to take a moment and reflect on who's inspired you along your journey. When I think about who's inspired me, I think about my parents, my family. I think about previous bosses that I've had the opportunity to work with and for, as well as current bosses that I have the opportunity to work with. I think about strong women who have paved the way for me and so many others. I think about historical figures and true warriors of our time. And of course, I think about this incredible group that I've met through the Academy. But what I can't stop thinking about is Kayanne and Andre. Kayanne is a strong and talented CNA. Her communication skills and her ability to build relationships with residents and families is incredible. She is literally the best of the best, and her potential to grow is boundless. And I think about Andre. Andre has started out his career as a server in our cafe. He transferred to activities, and now he's a supervisor. Andre has a passion for service. His personality is larger than life, and he has so much potential. But if we look at the statistics, they say that Kayanne and Andre will likely experience burnout. And with industry turnover at over 35%, we're at risk for losing them. So what does that mean for our industry? Who will be our next generation of leaders? Our associates that are burning out are inspired, and it's our job as leaders to provide that inspiration. So how do we do that? How do we cultivate effective leaders? The number one attribute of an effective leader is strong people skills. the ability to listen, the ability to develop others, and the ability to empower others to find their true potential. One way that we can do that we can build the next generation of leaders and we can help people find and fulfill their potential is through mentorship. Ralph Waldo Emerson said, "Our chief want in life is somebody who will make us do what we can do." So my project is to start a mentorship program here at my community, the Village at Gainesville, and pay it forward to our associates in helping them find and achieve their dreams.
My name is Lisa Coe. I'm the Director of Support Services at Paradise Valley Estates. The name of my action learning project is We Are in This Together, a mutual aid plan. Imagine it's just another day caring for the seniors we all love so much. When all of a sudden you get a call that there's a fire barreling down towards your community. Unfortunately, this isn't something I just imagined, nor did it happen to me only once. It happened twice. In that moment, you will likely ask yourself so many questions, like where are you going to go? Is it going to look like this, or might it look like this? And how are you going to get there? Will you have enough vehicles with wheelchair accessibility to meet the needs of your community? Who is going to help you in your time of need? These are just a few of the questions that may come flooding through your mind during this difficult time. We were taught through the Leadership Academy to identify gaps in the industry and find solutions to fill those gaps. This is clearly a gap, and it is just not okay. We need to have a mutual aid plan in place where at the push of a button, an emergency response system is activated, communities come together, vehicles are dispatched, and nursing home beds are readily available. Don't wait. First responders are amazing, and we cannot thank them enough for all that they do. But we in senior living have unique needs, so we must work together. We recently evacuated my community, and some of our residents had such a great time, they asked if we could do it again every year. What this reminded me was that if we come together, we can truly meet the obligations that we have made to our seniors, even during challenging times. But don't wait. Imagine now that when you receive that daunting phone call that you were already part of a mutual aid plan. Imagine how much better that would have felt. Remember, the only right way to wait is remember that we are in this together. Please ensure that your community is part of a mutual aid plan so you can be there to help others and others can be there to help you. Thank you for being part of the solution.
Hi, my name is Melissa Krall and I'm from Presbyterian Senior Living. My action learning project is called An Affordable Place to Call Home. If you haven't noticed, we have a national housing crisis all across America. And while this crisis is not new, it certainly has received heightened awareness due to the pandemic that we are all dealing with. I myself have been dealing with this crisis for over 10 years now. See, I have senior parents who both live with my husband and I because they had the difficult decision of deciding to either pay their increased cost for housing or have to pay for food and medication. My parents were lucky. They had us. Not so many seniors are so lucky. The problem with affordable housing today is the stigma that is associated with the word housing. Affordable housing, of course, is perceived to be dilapidated buildings that are riddled with crime and cause a decrease in property value. This truly is not the case any longer. The buildings that are being built today are beautiful communities that actually have amenities and services that are truly focused on the health and well-being of the seniors that they serve. Ever since joining LeadingAge National, I have learned that it takes true partnerships to be able to try and resolve these issues. And these are serious issues. Joining together, we can make an effort to be able to resolve these concerns. With housing, for me, it is the first and most important item that needs to be addressed because without a home, you don't even have the bare minimums that you need to be able to live. So as part of my ALP, I am going to be able to continue to focus on increasing the voices for the people who've been silenced for so long and advocate on their behalf for affordable senior housing because this is what they deserve. Remember, dreams happen in a home, life happens in a home, laughter is listened to in a home. All seniors deserve to have a place to call home. Wouldn't it be great if we could tell more seniors, welcome home?
My name is Denise Stagdagan, and I work with the Ingleside Group in Rockville, Maryland. My ALP is supporting the workforce beyond the workspace. These last few months, we've seen so many banners and so many videos thanking our workforce heroes for all the things that they're doing for our older adults and for anybody in general. But how are we really supporting them? When life had to move on and schools closed and now everything is hybrid and there's daycares are closing, how are we really supporting our healthcare workers? Did you know that in 2017, there were about 23 million children under the age of 6 years old, and about 60% of those children had both parents working in the workforce? From a different perspective, there's about 40% of our workforce are working moms. There's a lot of responsibility in juggling both the work requirements and home life requirements. U.S. businesses lose about $4.4 billion due to absenteeism. 45% of our healthcare workers or workers of our workforce have to change their schedules because of challenges with their childcare support. 65% of the workforce have to change their schedules at least 7.5 times in a 6-month period. There's about, if we could provide healthcare workers with that kind of support, the childcare support within our facilities, we could possibly turn that around and have a positive impact on our healthcare workers. You know, 60% of turnover could be reduced, and 40% of the healthcare workers would stay in their jobs, and we could reduce absenteeism and employee turnover in that manner. If we can provide healthcare workers with childcare support within the facilities, we can not only help our healthcare team, but also our older adults, because we know that having younger children within the community helps our older adults and their, tackle their loneliness and boost their emotional self-esteem. And we also allow the children to learn from the older adults, other than just learning from textbooks. They can actually hear from live experiences from these older adults. So why not support our healthcare workers by providing a childcare support within the facilities, and that way we're supporting them beyond the workspace. Thank you.
Hi, my name is Ellen Dunn. I'm with Campbellstone Retirement Living in Atlanta, Georgia, and the title of my project is There's Hope, Behavioral Coaching. My community is a community of 360 low-income seniors in the middle of Atlanta. And one of the tenets of being a resident here is to sign and abide by the house rules. One of the house rules that's stated over and over and over is that all residents are entitled to the peaceful enjoyment of the community. And however, no matter how many times this house rule is written, it's broken more than not. I spend countless amount of time dealing with this house rule. I spend time resolving conflict. I spend time going to court. I spend time with families looking for solutions. I spend time resolving conflict. I feel as if all of this could be avoided if there was help for untreated, undiagnosed mental illness, and I believe it would keep us from evicting residents into the streets. Examples of situations that lead to this are situations where people are seeing things. They look out their windows, they believe people are looking at them, they believe that their possessions are being taken from their apartment. Situations where residents are hearing noises that don't actually exist, or situations where residents are smelling things or believing that our staff is putting gas through their vents. Situations such as hoarding, which is in this picture of an actual eviction that I had to go through. My suggestion is that a behavioral coach be assigned to all low-income communities where untreated mental illness is prevalent. A coach would help focus on housing, keeping residents housed, keeping them from getting lease violations. A coach would have a whole-centered, person-centered approach to connecting residents to services, and a coach would help with the overall peaceful enjoyment of the community for all people. This is my hope not only for my community, but for all low-income communities with untreated, undiagnosed mental illness. Thank you.
Hi, I'm Kim Evanson with Westminster Village in Scottsdale, Arizona, and my learning project is Why Aging Services, Sharing Our Stories. Why did you choose Aging Services? Why did your employees? Why did your residents choose your organization? Employee recruitment and retention is something all industries struggle with. We spend a lot of time talking about why people leave, but I want to change that and start talking about why people stay and why they choose our industry to begin with. We all have stories we can share, and we need to share them. It's easier now than ever to share our stories thanks to social media. During the Academy, we were fortunate to visit various organizations and see and hear about the innovative things these communities are doing to meet the needs of their residents. Let's share those stories. Let's share our employee stories. Stories like Kathy McDaniel. Kathy is the one in the red hat, just to the left. She shared with me that she knows without a doubt that her life purpose is to work at Westminster Village and serve our residents. Kathy's been with us for 16 years. Her passion is music, and she teaches music appreciation to our residents once a month. She loves bringing back memories to the residents through music. One of her best memories to date is when a nonverbal resident began singing along with her. It just so happened that the resident's daughter was present at the time and was blessed to witness this beautiful moment. Moments like these are priceless, and for residents to know and their families to know that their loved one is being cared for and engaged is very comforting. And I know this firsthand because I experienced it with my mom. And I'm eternally grateful to the people who cared for her and cried with me and dispelled my preconceived notion of what assisted living was. We provide amazing places for people to live and comfort to families. My mom is my why. I want you to find yours. Find your employees' why and your residents' whys, and let's share them. We work in an amazing industry. Let's tell people why it's so amazing.